Hi, I'm Amanda Ralph, a nurse practitioner and the owner and founder of White Coat Aesthetics here in Las Vegas, Nevada. All right, this is my hot take on the aesthetics industry. I really believe that it has become a little bit too casual. I think that the injectables industry and the aesthetics industry has been looked at more like getting your lashes, getting your nails done, and instead it should be treated like a concierge kind of medicine. Let me explain. Although, it is a beauty treatment, and I understand that we're doing our lips, we're doing our Botox like we are doing with anything beauty. These are medical procedures that can go wrong and have actual medical risks to them. I am kind of sick of seeing the med spas that just get people in so quickly and frequently and never say no and let people just pay for whatever they want to pay for, because I am now with these clients having to fix bad work or work that has been done too casually. For example, I have clients who just have it ingrained in them that they need to get their lips done every single year. And it's just like another little maintenance thing like they do with everything else. And I am trying to rewire all of my clients' thought processes that it is not just a quick little touch up on lips, but still we need to look at the overall face. I can't tell you, especially in the last 6 months, how many of my return clients I've had to turn away from doing lip filler because we just don't need more lip filler. And I can prove it because I have an entire photo system. So I will take pictures of my clients, bring them back in, have them take a look at the pictures from the first time we did them to now. And sometimes you'd be surprised how long lip filler truly lasts. If we just keep adding lip filler and lip filler and lip filler every single time a patient thinks that they might need more, this is how we get migration. This is how we get that unnatural look. And we are realistically going to be doing injectable treatments for 40, 50 years of our lives. We can't overdo it in our 20s and our 30s because we are not going to look good when we are 50. Another point I want to make when moving this all back towards medicine and concierge type of medicine is that it is all too common, in my opinion, for patients to come in and try and tell us how many units they need in an area. I have clients that will come and say, I don't need the full 50 units because I usually only get 10 and it does enough. The problem with that is that now it is you trying to practice medicine. I'm not saying that this doesn't happen, but it shouldn't happen that you go to your primary care provider and say, I want 50 milligrams instead of 25, or I only want 25 milligrams instead of 50 when we're talking about blood pressure or anything dealing with the body, right? This is a very similar field. It is medicine. When I am telling you how many units I suggest for an area, it is based off of years of injecting experience, me seeing how people respond to these, and it is also based on the FDA approved dosage guidelines. For example, the FDA, what gave it its indication to use Botox and also prove that Botox lasts 3 to 4 months was based on using 64 units. If I only give you 10 in an area that was indicated to have 20, I am now not guaranteeing you the results that are given in that study. And so we are going based on actual guidelines and guidelines based on an FDA approved study rather than just what we think that we need in a time. Because those same patients are the ones that tell me, oh, well, I want to come back every 2 months, when we know that coming back any sooner than 3 months is going to put you at risk of creating some sort of neutralizing antibody where the product won't work. There are reasons that we dose the way that we dose, and I really believe that aesthetics needs to go back to that medicine type kind of area rather than allowing it to be so casual where the clients are telling us what to do. Another point of this, with medical aesthetics, like I said, there are actual medical risks. So we can't be treating this casually like nails and lashes. Although lashes, there are still risks. And again, you should be going to a provider that knows what they're doing. With medical aesthetics, I want you to be 100% certain that the person you're going to understands the risks, knows how to treat some of these more intense risks like vascular occlusion, long-term issues like granulomas, biofilms, nodules that can form. If you aren't confident that the injector you're going to fully understands how to treat these things and is in a practice designed to help treat some of these serious potential outcomes, you shouldn't be going there. If you're familiar at all with how concierge medicine works, I used to work for a doctor who went VIP or concierge, and this is how it works, is that there's basically an added premium just to see the doctor, and then you still do your regular doctor's appointments through insurance. It's not cheap. I'm not trying to say that it's cheap. I don't think that the injectables industry should be cheap, if I'm going to be totally honest. I want it to be accessible. I want the people who want it to be able to access it. But these products are very expensive. And on top of that, you should be going to someone who is investing a lot of their time and work back into education, which makes things slightly more expensive as well. With that, I feel that you should be given a full face consultation, at least on the first time you come to an injector, and if not, repeated every other year. For some of my clients, they're young, they're really early on into the injectables, side of things. You don't need to come back to me for a full face consultation every single year because you're not aging that quickly. But for my older clients who we are really trying to kind of get on top of things before they become, too far gone, I would say every other year is acceptable if we are actively treating things throughout that time. A full face consultation takes a look at your entire face. We talk about everything from Botox, filler, Sculptra. We also talk about medical grade skincare, lasers, chemical peels, all of the things that are available to you rather than just spot treating. I believe that this is how we're getting this pillow face that we're seeing, how we're getting these duck lips, these crazy migrated lips, is people who just go in, the injector barely takes a look at them, adds more filler, barely has a conversation about it, doesn't look at past pictures, and this is why people are starting to look unnatural. It should be treated like concierge medicine with a very long one-on-one full face balancing appointment where we discuss all of the options, we look at pictures, we make sure that we're not getting anywhere near looking crazy, and just practicing ethically. This is my hot take. I know that there are places that just whip out 100 lip fillers a day and are just adding and adding and adding without ever doing a full consultation, just as you would go into the nail salon and tell someone that you want to do a new set. For me, this should be separated. We need to go back to medicine and really create more of that concierge medicine kind of experience rather than making it more of a beauty kind of treatment that you can get anywhere. Okay, tell me your thoughts. I want to know in the comments. Do you agree with me? Do you think that it should be more of a concierge medicine? Do you feel that we should continue to go as casually as we are going? I'd like to know.